Sound is often treated as an aesthetic experience. Within a clinical setting, it functions as a medical instrument. Mention music therapy to most people, and they picture a nurse turning on a relaxing audio track to calm a patient down. True music therapy is a structured, evidence-based intervention requiring a qualified professional to drive measurable physiological changes. Sound acts as a highly organized, nonverbal language capable of directly altering a patient's neuroanatomy and their endocrine system. Clinical music therapy leverages the brain's distributed network architecture to reorganize damaged neural pathways and actively modulate biochemistry. To understand how this works, we must break the intervention down into three biological mechanisms: rhythm, melody, and biochemistry. Viewing music as a predictable biomechanical force rather than a subjective art form is the absolute prerequisite to utilizing its clinical effects. We begin with rhythm, the most physical component of sound, and its immediate impact on the brain's motor circuits. Internal, chaotic physiological processes naturally align to dominant external rhythms through a phenomenon known as entrainment. As the waves sync, auditory rhythms activate and prime the brain's motor cortex prior to the initiation of any actual physical movement. This sequence is specifically valuable for patients with Parkinson's disease who suffer from bradykinesia, or severe slowness of movement. Because their internal neurological timing is compromised, rhythmic auditory stimulation serves as an external, stabilizing pacemaker, effectively overriding these internal deficits. Clinicians use this mechanism to regulate and smooth erratic gait patterns in geriatric and neurologic patients, allowing for more stable movement. Rhythm provides a structural neurological scaffolding that can carry the weight of severely impaired motor networks. If rhythm provides the physical pulse, melody requires a higher level of cognitive complexity. Processing a melody forces the brain to recruit distributed networks, engaging auditory, emotional, and executive areas simultaneously. Heavily engaging these wide networks over time drives neuroplasticity, the brain's ability to reorganize its connections. Look at this schematic of a brain with aphasia, the loss of speech following a stroke. The highlight indicates a static, blocked lesion in the left hemisphere language center, Broca's area. A standard verbal prompt travels the normal pathway and stops at this neurological roadblock. The clinical intervention substitutes that spoken prompt with a melodic one, asking the patient to sing the answer instead. This melodic prompt avoids the damaged left hemisphere. It carves a detour through intact right hemisphere auditory and emotional regions to reach the speech output centers. This specific, evidence-based technique is called melodic intonation therapy. It allows stroke victims who cannot speak a single word to regain functional language by utilizing musicality to organize their thoughts. Melody provides a structural detour for the brain, turning intact neural tissue into a bridge over catastrophic neurological damage. These specific structural impacts can be continuously tracked all the way down to the level of synaptic biochemistry. Structured music therapy directly and reliably stimulates the brain's dopaminergic reward system. As the session begins, dopamine and endorphins sharply trend upward. This targeted spike translates to increased patient motivation and measurable analgesia, the reduction of physical pain in hospital settings. At the same time, a rise in oxytocin facilitates social bonding, which is particularly effective for patients with autism spectrum disorder. This is coupled with a simultaneous suppression of cortisol, the primary stress hormone, to stabilize the patient's biochemical state. Regulating this specific biochemical cascade allows therapists to stabilize the emotional baseline of patients suffering from severe trauma, such as PTSD. Because trauma often shuts down the brain's verbal centers, music provides a nonverbal pathway to the nervous system. This allows for treatment without requiring the patient to explicitly process their experience through speech. Music acts as an active endocrine modulator, effectively dosing the brain with its own internal neurochemicals to regulate mood and social behavior. Stepping back from the biochemistry, we can see how these mechanisms dictate the actual methods used by clinicians. It introduces a unique clinical reality. The aesthetic quality of the music is entirely irrelevant to the treatment. A technically imperfect, simple rhythm is medically superior to a flawless symphony if it achieves the necessary therapeutic function. To achieve these functions, clinicians utilize 4 primary models: the Nordhoff-Robbins, behavioral, psychodynamic, and neurologic pillars, all converging to support patient outcomes. These frameworks range from creative and relational approaches to strictly evidence-based protocols used for physical rehabilitation. Clinicians focus the therapeutic interaction on the process rather than the final musical product. During these sessions, the music operates as a highly structured nonverbal language between the clinician and the patient. Music therapy redefines music, stripping it of its status as pure art and utilizing it as a calibrated instrument for behavioral change. Executing these complex neurological interventions safely requires specialized expertise. True clinical music therapy is a distinct medical intervention, far removed from casual practices like general music education or sound relaxation. Because the treatment triggers deep neurobiological shifts, it mandates rigorous academic formation and professional credentialing. It is an evidence-based complement to standard medical or psychological treatments, not a replacement for them. Music therapy serves as a functional bridge between human art and rigorous neurological science. It takes the chaotic, scattered impulses of a damaged system and organizes them into a structured, rhythmic grid. When conventional language fails and standard medicine reaches its limits, structured sound provides the neurological framework required for human recovery.